Well, ladies and gentlemen, now it's a time that we move on to a session exploring healthcare innovation, adoption, and what it truly takes to scale solutions that create real impact. It's the time that we are going to begin with the Fireside Chat, an intimate conversation with a healthcare leader on innovation, adoption, and scaling healthcare solution. And again, we are going to welcome our moderator. Please put your hands together for Sunanda Jayaseelan. And our guest is a physician, healthcare strategist, public health leader, and a passionate advocate for using technology to transform healthcare. He is the CEO of Center of Excellence in HealthTech and MedTech, Government of Karnataka, where he focuses on advancing MedTech and HealthTech innovations and supporting AI-driven solutions for public health, One Health, and climate change. With nearly 20 years of experience across clinical practice, health administration, public policy, regulation, disaster management, and healthcare innovation, he brings a truly diverse perspective to the ecosystem. He also serves in advisory roles with Bangalore Bio Innovation Center and Art Park IISc. During the COVID-19 pandemic, he headed the COVID-19 Central War Room at BBMP. An award-winning healthcare leader and entrepreneur, Dr. Bhaskar has also helped build healthcare education solutions that have reached over 1 million healthcare professionals globally. To lead us this engaging conversation, once again, ladies and gentlemen, let's give it up for our moderator, Sunanda, and welcoming our guest, Mr. Bhaskar Rajakumar. A big round of applause, everybody. A very warm welcome to both of you.
Thank you so much, Dr. Bhaskar. In the previous session, we were talking about the nuts and bolts, if I can call it that, really, of the healthcare system. What's it going to take, etc. I want to take a bit of a step back in the session and look at the big picture. Right? I want to talk innovation. I want to talk what's it going to take to move the needle on India, and your advice really for the entrepreneurs here. My first question to you, Charaka COE, the Center of Excellence, was set up in May 2026. You're just a few months old, but of course you have big plans. So on a war footing in the next maybe 1, 2, 3 years, what are those very important things that you feel has to be achieved?
Very good question. So before I answer the question, honored to be here. There are wonderful people in the audience. Got great learning since morning, attended a couple of talks. Uma ma'am is here, been a mentor for a really long time. Thank you for those insights. And practitioners who have been on the field, delivering tech and delivering healthcare, spoke in the previous panel. Great learnings there too, right? Like you rightly mentioned, coming back to Charaka, which is the Center of Excellence for HealthTech and MedTech, set up by the Government of Karnataka, is not 2 months, probably around 6 months. But it's been in the gestation for good 2 years, right? So it's not that this just started off just like that. Elephants take time to take birth, right? So it's around 24 months for an elephant to take birth. So yeah, so that's how it has been. The thought really started immediately post-COVID. We did a lot of work during COVID and we realized how important tech is in data-driven or evidence-based decision-making when you're taking those important calls, right? So that's when we really wanted to set up something which can make this a systemic approach, not just a reactive one. That's most of the work what we did during COVID was reactive because we were hit with an emergency and we wanted to do something. But how do we systematize this was the question. That's when the thought of a Center of Excellence really popped up. It got registered in 2024, but the thought started in 2022. During COVID. So from 2024 onwards, a lot of administrative work has been going on. I was onboarded in around Feb, March of this year, officially onboarded. What do we really want to do? I would keep it pretty simple, right? So a lot of problems were highlighted since morning, right? So exactly that is what we are trying to solve. First things first, from the innovation side, if you really look at the problem in India, if you ask me, do we have a problem of innovation? No. We really don't have a problem of innovation. The number of startups which are rolling out in India is immensely high. But the problem where we really see is in translation. When it hits the ground, unfortunately, they do not survive. Like Uma was mentioning, they may not be focusing on problems which are actually the real big problem for the practitioners. So only then you'll solve the problem. That's where we are trying to look up the startups and line up these startups for practitioners. There are multiple ways to do it. Second, problems for startups themselves. So, a speaker in the previous panel was mentioning a 4-time entrepreneur. What will government really do to help entrepreneurs take those risks? Right? So how will we really be able to help them out in the process? That's the second thing what we're really focusing upon is building these validation engines. So you need support at multiple stages. It's not just to establish an organization, but beyond that, when you want to run the whole journey, you need multiple stages, you need multiple kinds of support. Especially in a healthcare startup, you would need support in clinical validation, you would need support in economic validation, you would need support in deployment or implementation validation. You cannot just build a product and go to the market right away, right? So how will you build these sandboxes where you can go and test them out, right? So third important thing, what Charaka is really focusing upon is creating a single window kind of an approach, right? So it not just for startups or innovators, it is for everybody in healthcare, right? So today, if there is a product which is built, let's say by an entrepreneur, he wants to sell it to the government. Where does he have an idea about where he should go and talk to whom to sell this? They'll have to knock on multiple doors to talk to multiple people and figure out will it really fit into the environment or not. If he has to get it validated by somebody, whom does he have to talk to? If he has to get incubated, there are so many incubators today. Who's the best possible incubator for him? Who will give him the best possible leverage? So all these questions to be answered, we are trying to create a single window. So while Charaka becomes a single window, we will guide them and say, or nudge them to say, this is the direction you're supposed to move. Might be, you might see the maximum possible benefits in that direction. Largely, these are the 3 things what we're focusing upon.
I was just looking at your list of objectives, and you have 4 pillars. You have, of course, I'll just read this out. You have startups, government, healthcare institutions, and industry. You were saying loss of translation in some sense. How do you ensure that there's no loss of translations when you're dealing with these very, in some sense, diverse sort of pillars or objectives that you're looking at?
Very good word used there, right? So translation is a wonderful word used because it's basically all of us, let's say startups, hospitals or healthcare providers, or innovators, or the government, all 4 of us are basically talking the same thing. So the outcome what we are expecting is to deliver affordable, accessible, and quality healthcare to the public. Do we have some other goals? No, all of us have the same goal. But the communication language is different. A startup is looking at few things which is very different. They are looking at speed. They are looking at quick wins. They are looking at innovation. When you look at government is basically looking at sustainability. Government is looking at equity. But when you look at your investors, they are looking at conversion values, right? So how will you speak to all of them in their own language? So that's where the translation comes up. In simple terms, Charaka is trying to really play that role of a translator. If a startup is speaking a certain language that has to be communicated to the healthcare provider in a certain way, can we be the translator which will communicate this to the receiver in the language they understand? If a startup, to take an example, if a startup comes up with a certain application and he wants to pitch it to the doctor, if he's speaking full technical language, the doctor may not be able to receive it, right? So he is looking at how will this really benefit me when I'm sitting in the clinic and looking at my patient? Can I help this startup communicate in this way? That's one part of the translation. When he's talking to the government, the kind of language what he'll have to understand is very different. So how do we help these innovators, startups, or the organizations communicate in the way the receiver actually understands is something, what is the real translation Charaka is focusing on.
I was also doing a little bit of reading about Charaka's COE. I'm sure the audience is well aware, but I was just very interested to know what really has gone behind founding and the ideology. One thing I noticed is that there's a huge focus on AI. Now, if you were to look at centers of excellence across the country, please correct me if I'm wrong, but it seems like Karnataka has more of a focus perhaps. So for other states or for anyone else who's looking at you as a model of success, what would you like to tell them?
Yeah, model of success is too far a reach already, right? So we are just 6 months old. I wouldn't claim the success already. But speaking about the state, right? So all of us, without a doubt, know that Karnataka has been a pioneer when it comes to tech or tech innovations or support to tech innovations. So that has been the case, not now, but for the past 2 decades or so. The same thing is happening in health tech or healthcare also. Right? AI is just one part of the overall thing. Across health tech, there is good amount of focus and push from the government. From the basic and the simplest part is putting money there. We have the Elevate program, which most of the entrepreneurs today in the state would know, where we fund anywhere between 25 lakhs to 1 CR as a grant in aid, which is the highest amount given to any startup at an idea stage anywhere in the country. So that is through that, only in healthcare in the past 5 years, we have supported more than 300 startups, right? So, which is a significant number. So beyond that, there are again 27 incubation spaces which are set up across the state. So where any startup who wants to go establish themselves, try something out and build something out of this maker space, they have access to all of these things. I don't think so. No other state has such kind of a diverse ecosystem. We have stars in every state. Like, so none of these incubators, if you ask me, are a match to something what IIT Madras has. IIT Madras Research Park is amazing. But do you have it in every tier 2 city, tier 3 city is the question mark, where a lot of these innovations actually come out from, right? So because the problems are there. That's what we are trying to do. So if you ask me why Karnataka is leading in certain directions, is because of this. This is the vision what the leaders of the government or the group which is thinking in these lines have put together, not now, from the past a decade or so. So that's why we have been able to show that outcomes. While a lot of people are looking at outputs, see, I can always pat on my back and say I've supported 300, 500,000 startups. But are we really seeing the output on the ground? The proof is in the pudding. So that's what Karnataka is looking at doing. If you look at the outcomes, that's what we are seeing today. If you look at the major startups, name it, you have Cure AIs of the world, Niramais of the world, your 4Base Cares of the world, all of these guys who are making global impact today, they are all brought up in Bangalore or Karnataka. Why is it happening? Is because the ecosystem is built in a way to support and grow them.
When we were speaking offline, you made this beautiful analogy. You said to bring up a child, you need a village. And that ecosystem is prevalent in Karnataka. And to no small extent, of course, is also the manpower, the technically sound manpower that you have available in Karnataka.
Yeah, that has been an advantage, right? Yeah. So thanks to all the institutions which came up after the 1990s, the kind of talent what you get in Karnataka is unmatched. So it is probably only matched to some of the Ivy League universities outside of India. But anywhere in India, the kind of talent what you get access to in Karnataka is absolutely unmatched. Be it healthcare, be it tech, be it any other field. That puts us in an advantage. We are already on a pedestal.
If I could play devil's advocate for a minute and talk about the fact that we're seeing this huge innovation when it comes to healthcare, but it's largely restricted to the private sector. But for a country like India, for anything to be a true success, you have to have innovation and disruption in the public space as well. Is that happening?
But see, I would counter that. That's a myth. If you really look at innovations and mention these innovations are largely happening in the private sector, because the kind of innovations which are really happening in the public sector or even within the government is huge. Only thing is we don't communicate so much, right? So we don't go out and tell so much about the kind of innovations which are really happening within the government. See, take for example, a lot of work which is happening within tuberculosis management, right? So tuberculosis has been a big problem for India for God knows when, right? So, but look at the numbers, how tuberculosis is coming down in the past few years. That's because of the innovations which are happening. To take examples, we're talking about Cure AI, right? So Cure AI has built an AI algorithm which helps identify tuberculosis with just X-rays without a radiologist anywhere they are sitting, be it tier 1, tier 2, or a primary healthcare center. That kind of innovation is helping in screening at a very, very early stage. Beyond all of that, there are applications which are using cough sounds, lung sounds to diagnose tuberculosis. How many of us really know that these applications are used today within the public health system to screen millions of people? So, thank you. So in a private, what happens is we tend to show these things to gain that commercial value. Because if I put up AI assisted or robotic assisted in my tag, that builds up a commercial, nothing wrong about it. It builds up a commercial value to the organization. But government really need not do that. So that's why you don't hear so much about the public health innovations which are integrated within the government system, but there is a lot of work happening there.
Dr. Bhaskar, when you started this conversation, you spoke about COVID. Before and after, if you can give us a picture of how things have really moved on the ground because of the use of tech, what's that like?
Oh yeah, a lot of things have changed, right? So it's a pre-COVID era and the post-COVID era, what we keep talking about. One of the biggest thing, even without mentioning technology, what really changed after COVID is the behavior, right? As doctors or healthcare providers ourselves, whenever there was a new tech which was coming in, there was a resistance to accept those things, right? So what we look at is, like Uma was mentioning in the morning, if it is of real use to me, I will accept it. But even for that acceptance, there is a significant resistance because we don't have too much of leeway to err. So I cannot err. Even if it is 1%, that's a life at cost, right? So that acceptance levels changed after COVID. They started looking at tech as a friend rather than just somebody from outside. So that started changing significantly. The first stage happened with telemedicine because of that it eased out a lot of efforts for the doctors. Beyond all of that, the tech which was within the hospitals or within the public health system really changed because data-driven decision making became a norm across. Right? So much we are talking about data today. We are mainly focusing upon ML-driven data or image-based analysis when you're talking about all of these AI models. During COVID, we did not have LLMs, by the way, right? So we were never heard of ChatGPTs of the world or Geminis of the world or Claudes of the world, right? We had engineers, we had scientists who were looking at case-based data, giving us predictions day in and day out, helping us understand how do we take these decisions and ensure safety is provided to the community at large. This, as doctors, started to realize is very, very important. Beyond just looking at my hospital, beyond just looking at my patients, there was a world which was lying outside. So public health tech caught the major attention during COVID, which has changed the way we are really, as doctors, we are really looking at technology or data-driven decision making.
Sure. We've had some interesting questions coming from the audience in the previous panel. If you could talk to the entrepreneurs today in the panel, in the audience, and leave them with one piece of advice as we're closing today's panel, one piece of advice that you want to give them on a very aspirational note, what would you like to tell them?
As entrepreneurs, I've been a 3-time entrepreneur myself also. So as entrepreneurs, what we tend to do is basically 2 things. One, we celebrate too early, right? So ma'am, with your permission, so we have a disease called pilotitis. I picked it up from one of ma'am's presentations. So we have innumerable pilots. We keep on developing and delivering pilot after pilot after pilots, but they all die because we tend to celebrate at a pilot. See, I'm a runner, so if I'm running a marathon of 42 kilometers, if I celebrate after the first circle within the stadium of 100 meter, means nothing, right? So that is a pilot. So means really nothing. You'll have to be there for the long run. Don't celebrate too early. Your pilot success does not really mean it will be adopted. It will be implemented. It's a success. So wait for it. Don't celebrate too early. That's the first one. Second real one, I've said it already, I'll say it again, is don't fall in love with the tech. A lot of exaggeration is given today to AI, to whatever tech they are using. Please don't fall in love with the tech. Tech will change. AI of yesterday is very different from AI of today. It will be very, very different from AI of tomorrow. Same thing with any tech. Tech is only a bridge. Remember that tech is only a bridge, right? So please don't fall in love with your tech. Fall in love with the problem. That's what we doctors do. We fall in love with the disease. The day, thank you. So when I start treating a patient, I would love to know more and more about the disease. So that's what a startup guy should do. Fall in love with the problem. Try to understand the problem as much as possible. Go deep into it. Don't start washing your hands and start solving the problem immediately you find it. Dig deeper. Fall in love with the problem. So those are the two things I would love to end with. Thank you.
Thank you so much, and for encouraging entrepreneurs to keep really your eye on the problem and look at it from the long-term perspective. Thank you so much for your time.
Thank you. Thank you, All Health. Thank you, Karthik, for this opportunity. Lovely gathering. I would love to meet all of you. I'm going to spend a little more time here. Love to learn from all of you. There is a lot of experience lying in the room. Please enrich me with your knowledge. Thank you.
Thank you for your time. A round of applause for Dr. Bhaskar again. Thank you.
What a great conversation. Once again, thank you so much, Sunanda, and thank you so much, Mr. Bhaskar, for that valuable perspectives, for all the discussion, what we have done so far. We had an amazing conversation and insights. I request Gayatri Vivekanandan to kindly join us on stage to hand over the token of appreciation for our guest today and for our moderator, Sunanda, as well. A big round of applause, ladies and gentlemen, once again. So once again, let's give a huge round of applause for Sunanda for making it very engaging and insightful. Thank you so much, Sunanda. Thank you so much. Thank you so much, madam. Yes, all of you together for one group picture as we freeze this moment. Thank you so much once again. Thank you so much, madam, for joining us on stage.